Let's compare and contrast state protocols and updates to OCMCA protocols and updates. There's this problem recently that's been identified that EMS providers receive emails and the Wednesday update from the state of Michigan, and this may create confusion regarding what is a state protocol or rule versus what is practice in Oakland County. And it can be confusing if the state sends you an email and say, here's the new protocol and we're the state. Well, an EMS provider might say, okay, but there's a conflicting protocol in Oakland County. Which one do I follow? Bonnie, state protocols versus OCMCA protocols, which do I follow?
You follow the OCMCA protocols 24/7, 365. That's the bottom line. The state comes out with protocols on their own. MCAs have the right to accept or deny. They may change it up a bit, but it's always approved by the state before it's implemented in any MCA. Bottom line, you follow the OCMCA protocols at all times.
Dr. McGraw, anything to add to that?
She said it exactly right. Where I think is we ought to really tip our hat to our colleagues at the state. They are trying to write protocols statewide that have a greater capacity to be applied more uniformly throughout the state. What a great and effective down the road benefit that's going to be. But you can just imagine how hard that is in such disparate communities like, say, Ironwood, Michigan, or Traverse City, or Detroit, Michigan, Flint, Kalamazoo, or places like Farwell. These are communities that have different capacity, different needs, different populations, different transportation guidelines, and different densities of facilities to whom they can take patients to. Because it's hard to write on the state, and I do understand the challenge they face, protocols that'll cover all those different and disparate communities, the EMS Act very wisely gave medical direction to the local MCA at their discretion. As Bonnie correctly pointed out, protocols that are adopted or recommended by the state can be adopted by a local MCA, but they aren't required. Just the opposite. We are required to write our own protocols and have them approved at the state through the QA task force, which we continue to do to this day. The simple answer is when in Oakland County, you follow the Oakland County MCA protocols. Hard stop.
Bonnie, I get these Wednesday updates from the state. We talked about OCMCA protocol app notifications and emails from the med control about all these protocols. So it sounds like no matter what I get from the state, no matter what I get from med control, follow Oakland County protocols first, unless state protocol is the protocol that our med control has adopted. So if I was to open up my protocol app and I start going through all the protocols, I might see some that the header says state protocol. That's the one our county adopted. And then there might be some that say Oakland County at the top. That's because we didn't adopt the state protocol. We decided to have a modified version of that. Is that a good summary?
Or a state protocol doesn't even answer the question that we put a protocol in place for, that it was a novel for Oakland County and a condition we encountered, and a protocol written with the participation of our providers in our county, wrote it, provided it to our providers, the state approved it, and it's specific to Oakland County. That does happen too.
Yes, I love that the state is emailing out the Wednesday updates to all of our providers in the state of Michigan. That is relatively new in the last year or so. I applaud them for that. The problem is it can be kind of confusing when you get those and you see protocols in there. The easy answer is go to our protocol app or go to our website, look up the protocol and make sure we are utilizing either the state format or we created our own.